Okay, I'm going to talk about transgender children a little bit. So there's this debate out there that says, or between people who believe we should treat transgender children with hormone replacement therapy, okay, HRT. And then there's the opposite side of the debate who argue we should not treat these children, okay? And the people who believe we should treat the children, they argue that these children feel they were born into the wrong body. They were born with the wrong biological sex. They feel like they're the opposite gender, and therefore we should treat them with hormone replacement therapy to effectively make them into the opposite biological sex, right? And the people who argue against treating these children, these transgender children, they argue that, you know, these children were either born into the right body and therefore we shouldn't treat them, or maybe they argue that the children are not old enough to make these decisions that will permanently change their body, right? So I'm just going to say that, like, I don't have a hardline stance on this issue, okay? I ultimately am kind of laissez-faire. I think we should allow people to make their own choices, okay? I think we should allow children and their parents, their guardians, their families to make these decisions in private by themselves. And if you're an outsider looking in, you should just mind your own business. So, that being said, I'm going to make an argument kind of for the treatment of children, of transgender children, okay? And I'm going to ask you a question at the end of the video, and if you can answer it, I would like an answer to the question, basically. So here's the thing. Okay, we're treating these children because they feel like they're the opposite gender, and therefore we take the steps to make them the opposite biological sex so that their gender and their sex match, right? So here's the thing. I have hypothyroidism, okay? And I've been taking levothyroxine since I was 7 years old to treat this hypothyroidism. Ultimately, I wanted to feel like somebody with a working thyroid, so I treated that hypothyroidism with the levothyroxine, right? With the medication. Now, what's the fundamental difference between treating a child who feels like they're the opposite gender and therefore wants to be the opposite sex, and me in treating my hypothyroidism with medication because I want to feel like somebody with a working thyroid? There's not really a good way to remain logically consistent and while arguing that I should be allowed treatment and the transgender child, should not be allowed treatment. So, to add another example here, and this is kind of where I got the idea for this video, but Joe Rogan there's a YouTube short, and maybe I'll link in the description. He's debating somebody on his podcast about whether or not we should treat transgender children with hormone replacement therapy. Again, HRT. So, on the other hand, Joe Rogan has always talked about his hormone replacement therapy that he gets. I think he's on TRT, testosterone replacement therapy. So, Joe Rogan is here arguing against treating transgender children. Meanwhile, he is treating himself to replace with testosterone replacement therapy. So, Joe Rogan's what, a 55, 60-year-old man, and he wants to feel like a 25-year-old man. So he goes on TRT, right? Now, what's the difference between Joe Rogan going on TRT to feel like a younger man and a transgender child going on HRT to feel and become more like the opposite gender, or the opposite sex, ultimately? It's hard to make a logical argument that justifies Joe Rogan's use of TRT and denies transgender children HRT. And ultimately that would also support my hypothyroidism treatment, right? So my point here is that, or rather the question I want to ask you is, where do we draw the line? Where do we deny treatment, and why? If you can make an argument that logically denies transgender children treatment, but also allows TRT and the treatment of hypothyroidism in children, I'd like to hear it, okay? Because ultimately you can't make a logical argument. You will contradict yourself. The point is that, you know, here's the thing, like hypothyroidism it's common. I think it's the most common autoimmune disorder there is. And, you know, we've been treating it for a long time, and we've kind of proven that treatment is safe. And therefore, we treat it, right? On the other hand, TRT for older men and even younger men, and also HRT for transgender children, it's a pretty new phenomenon. And we don't really have long-term data on it. We don't know if it's safe. So why are we justifying one? How can you justify one and deny the other? Again, where do you draw the line and deny treatment, and why? Because it ultimately seems to me that, you know, if somebody wants to get TRT, we should allow them to do it. If somebody wants to get HRT because they feel like they want to transition sexes, I think we should allow them to do it. And if we then gather the long-term data that supports or proves this treatment is dangerous, then we have that data. That's a good thing. But until we have that data, there's no way to say that treating transgender children is good or bad. And in the same way, we can't say that we should or shouldn't treat older men with testosterone replacement therapy. The bottom line is that if you're going to, especially for Joe Rogan, if you're going to be a man who sits here and argues against the treatment of transgender children, the hormone treatment, then how are you going to sit there and be on TRT? Ultimately, Joe Rogan is trying to, he wants to be a younger man. He wants to feel like a younger man. So he goes on TRT. Transgender child wants to feel like the opposite sex. So they go on HRT. There's no logical way, again, that you can argue against HRT for transgender children and argue for TRT for older men. Ultimately, we need long-term data to make a truly objective conclusion on this debate. And until we have that data, you can't argue logically against HRT for children and for TRT for men. So again, where do we draw the line and deny treatment, and why? Answer me that question if you can. Thanks for watching.